In 1763, the British gave blankets exposed to smallpox as well as many other diseases including measles and influenza to First Nations people. They were not immune to these diseases and did not know how to treat them. This resulted in epidemics and famines. Today, access to quality healthcare for Indigenous people in Canada is not as common as one would hope. Indigenous people living on reserves are typically at higher risk and are more susceptible to disease due to poor living conditions and geographical barriers separating them from healthcare facilities. Diabetes and heart disease have become more common due to the lack of resources that would allow a healthy diet and appropriate amount of exercise. First Nations children are 5 times more likely to experience tooth decay than any other Canadian child. First Nations people are also 8 times more likely to develop tuberculosis than the rest of the Canadian population. Living conditions on First Nations reserves are often below par, without running water or proper installation, mostly due to the bad economy. They are also often overcrowded in unhygienic environments. One house was reported to have 25 people living in a home with 3 bedrooms and 1 bathroom. That's around 8 people living in each room. Hepatitis A and other diseases have become more common due to contaminated water supplies. First Nations housing programs on reserve have helped provide adequate living conditions and help prevent disease and sickness. Living on a reserve presents geographical barriers that make it hard for people to even get to healthcare centers. Distance is the most prominent and often requires people to take long car rides and in some cases even plane rides. These circumstances make it difficult for expecting mothers and cause many of them to give birth via scheduled C-section due to risk of complications. The creation of more local healthcare facilities such as the Nojmo Win Tag Health Centre in Ontario, which is one of the 6 facilities that has recently opened nearby First Nations reserves with many professionals in Indigenous medicine. A woman named Michelle Lebrec went to her local hospital in British Columbia. She reported severe stomach pain and talked about her struggle with alcohol abuse. The doctor wrote her a prescription and sent her on her way. When she was on her way home, she realized the doctor had scribbled a beer bottle with an X through it on her prescription pad. This kind of discrimination was referred to as an unconscious white bias. According to the recent study, First Nations second-class treatment, this bias exists very prominently in today's healthcare profession and it has a very negative social impact on Indigenous people. Traditional Indigenous medicine, including herbal remedies such as sage, sweetgrass, cedar, and tobacco, are often used as well as sweat lodges in the practice of medicine. These methods are often dismissed in the world of Western medicine, which can make Indigenous people feel excluded from their culture. Adding private rooms in hospitals entitled sacred spaces have helped First Nations patients feel more comfortable and connected to their culture. It is a place for traditional medicine and prayer. More of these rooms would benefit thousands of people and should be implemented. Educating people from a young age on First Nations culture and traditions, as well as having special classes for people wanting to get involved in healthcare in order for them to have a better understanding and respect for the culture and its people, is crucial. The field of mental health is a perfect example of how the 2 fields of medicine can work together to provide impeccable results. The feeling of inclusion and spirituality have helped countless numbers of people overcome mental illness. By accepting everyone and doing everything we can to make sure everyone in Canada has proper access to healthcare, we can create a country and a world more united and create a positive future for the next generation of First Nations people.